No medicine can remove the cause of a lifestyle disease, but you can. Welcome to Lifestyle Disease Doctor. Today we begin a four-part series on a disease that affects millions around us. The disease is psoriasis, and in the first episode, we will be looking at what are the causes, the underlying reasons behind psoriasis, and what exactly is psoriasis. To begin with, the first question to Dr. Jolly is, what is psoriasis?
Psoriasis is an autoimmune disease primarily affecting the skin, and it will create different type of lesions on the skin. And according to the type of lesion, we call it as exfoliative or scaly psoriasis, or gutted psoriasis, pustular psoriasis, etc. Basically, it is an autoimmune disease, but it can affect the other organs also. That is the importance of an autoimmune disease, or the significance. It can affect the nails and also the joints. That is the most common. But I had seen patients with affecting the psoriasis, which is affecting the eyes also, with corneal ulceration and uveitis, etc. So basically, it is not only a skin disease, but it is a systemic disease also.
Lifestyle plays a big part in psoriasis. Can you explain on that?
Yes, definitely. Psoriasis is a lifestyle disease primarily. But almost all the lifestyle diseases has an entity of genetic factor also, just like diabetes. Diabetes is a lifestyle disease, but there is a predisposing genetic factor can be behind that. Just like that, psoriasis also is primarily a lifestyle disease. But basically, what we should understand from that is, if at all your mother is having, or one of your siblings or someone is having psoriasis, then definitely the chance will be high to affect you. And the study shows that around 30% of the twins can have the same. If one is having, that is 30% chance to develop for the other twin also. But you can, one should do. The positive thing is, the genetic factor you won't be able to control. But the epigenetic factors, the environmental factors, that is more important than the genetics in the diseases like psoriasis and all, that you can make a lot of difference by the lifestyle correction. That is, environmental factors means lifestyle. So if you correct the lifestyle, definitely you can make the disease away it's really in a great extent.
How does the immune system get involved? What is the connection between the skin and immunity?
See, basically, we should understand that the skin is a part of the immune system itself. So, immune system means protecting our body from the external part. It is the protective wall of that. It is actually the boundary of our body. And we are considering the skin is the boundary of our body, basically, physically, when we are talking about. So, when the autoimmune disease means your immune system doesn't know which is your part, your cells, or that is a foreign body. So, for example, when a bacteria is or virus is affecting you, the immune system think it is a foreign body and try to remove that. Here in autoimmune disease, what is happening is some changes in the cell, especially the body is made of food. Basically, it is only food. So, if some of the food is, or in the air factors, the air or the food is not polluted, or it is not, or you have any tolerance problem, then the immune system thinks that the cells made of that particular cell is foreign to the immune system, and they start attacking. Here in this skin itself, as the skin cells is attacked by the immune cells, especially these neutrophils and T lymphocytes and killer cells and so many things. And they just in the microscope of the psoriatic skin, it can see, the doctors can see, the pathologists can see that there is an influx of this immune cells into that. And this secretes certain leukotrienes and IL-6 or 25, or so many different names are there for that. So many cellular mediators are released, and this is actually creating faster turnover of the cell. Usually the skin cells, this basal cells to this epidermal, this superficial cells, the corneal cells will take 28 to 30 days. But here in 4 to 5 days, the cell turnover is happening. So that is why the reason this flaking and the cell is usually the 30-day life expectancy, but it is life expectancy is reduced to 4 days or 5 days. That is what is happening.
Is there a connection between gut health and psoriasis?
Yes, definitely. This gut health means gut is also the internal covering. Actually, we have an internal living system inside our body. So the gut having so many bacteria and viruses and so many undigested food, we can say that skin is comparative. There are also bacteria and so many other living organisms on the skin. But in the gut, it is much more. And most of the psoriasis patients who is having affection in the skin may be having some internal problems also. There are very common that psoriatic patients having mouth ulcers and all. It does, means that it is not only the mouth ulcers, your intestine also part of the mouth actually up to the anus. There can be ulcers, and the undigested food and bacteria can get into the body also. That may be one of the trigger mechanism for the our immune system to overreact. So it is clearly, studies also shows that the psoriasis can flare up after a tonsillitis or a streptococcal infection or a staphylococcal infection. It can flare up, but it is very known to the medical world.
Actually, when we talk about psoriasis, the issue, often the patients don't realize that it is the beginning of psoriasis. They may think it is some other sort of allergy or some infection and all that. So, what exactly can a patient do to get an early diagnosis so that they can treat better?
Usually, it's a skin infection or skin manifestation. It's not an infection actually. It is a manifestation of a internal problem for the immune system actually. This skin manifestation. We will small things we just ignore it. That is our nature. That is if you are trying to avoid it, and if it is after you can see that after viral infection and all there can be skin peeling and redness and it all comes, and it may go after that. But if it is persisting, then we should be serious about it and think that it can be an autoimmune manifestation or autoimmune disease. And there are many other autoimmune diseases which has skin manifestation also. So whatever is the problem, if it's just a skin disease only or some other manifestation of other internal organ involvement also, we should take care. And another more early sign is the scaling and this what we call is dandruff. And some dandruff and all we agree with that, and some hair treatment or this parlor treatment and all this. But if you are getting recurrent or severe this flaking of the scalp skin also, you should think that it can be an early state of the psoriasis. And also the skin problems, and it can be other things also can be associated with that.
Actually, what are the common triggers? Because sometimes psoriasis suddenly flares up. So, what are the common triggers that do that?
Usually, the triggers, it can be a stress. If you are facing a problem in the life, you can get if a person is prone for that or genetically predisposed to stress can lead to a flare up, and also certain food. And last day, actually, one of the patient is telling that I had psoriasis and I was managing it with it. But during the last festival season, that is Easter, he's a Christian, and the Easter, I had had a travel and the food control is completely gone. Now he's a severe flare-up. So that can also happen. And also the change in the climate. And basically, most important thing, what I understand is from my patient's experience, is the food and the stress. And even if you are giving proper protection for the skin, for the whole climate or something like that, then you can even manage that easily. But most the stress and this food management is the most important actually.
See, if it is so, if we can identify the triggers, and that is basically what is causing it as root causes, can we reverse these causes and then get freedom from psoriasis?
Yes, That is what that I am. My way of treatment itself is that actually. We all know that generally the psoriasis is incurable, and you had to take applications of the on the skin, and also if in severe cases you had to take internal medicine that is mainly of antimetabolite or steroid type of medication, or even immunotherapy. That is a severe cases we give that sort of medications, especially that are treated by the usually the rheumatologist or a skin expert will be giving. My expertise is actually on managing it with the clinically supported lifestyle correction. In that, basically, I had seen in severe forms like this erythroderma type of, that is a red skin with the severe flaking of skin, and also all sort of fistula, cuttata, all sort of psoriatic patients, and also with psoriatic arthritis and the nail affection. Everything I had actually I have exposed to and I had treated. And basically, if you are able to find out what is the triggering food actually, and then they avoid that. And also, actually, the stress, all the psoriatic patients will be stressed also. But once they are able to get a relief, their stress also will be reduced. So what I say is, it's a very, actually, with medicine, it is very difficult to treat it. Immediately, if you start steroids and all, there will be benefit. Or if you are the latest immunotherapy, you may be getting. But after that, it will be actually you're suppressing or manipulating the immune system. So the disease will, the skin manifestations will reduce, but you may get a thyroiditis or the hepatitis, or see if it is methotrexate and all is using, that is the very commonly used medicine. If it's a long-term use, not even long-term use, I have seen within 1 or 2 years, the eyes can be get affected in some people. It's not for everyone. So the permanent immediate flare-up, you can use it. If you are severe flare-up and all, then we had to use this immunosuppressants and all, but not for a long-term management. You can suppress it, then shift over to the lifestyle correction and come out of the medication itself. That is the ideal way to, and find the, you should understand, you should basically you should understand your body and the body's language. Actually, all these symptoms is the language of the body to show you that the problem is there. So understand that, find out the problem in the lifestyle, and avoid that, and then you will be able to manage it very well.
That gives a lot of encouragement to those who are suffering. Can you give an example of how this has happened for an individual?
Yes, I have. So I had treated many psoriatic patients. I can tell you one of the recent patients I can tell you, that is actually a very severe form of erythroderma type of psoriasis, and almost the 90% of the body was affected. He was staying abroad actually. So he came, he was looking for all the solutions. He had taken some treatment, but it is very severe exacerbation actually. So he found out from some searching the videos and found out this, and they studied the whole website and many videos, and then he came down to Kochi actually. Actually, in that stage, he was almost the 90% of the skin, and the skin is looking red and severe exfoliation also. He showed me a photo of the one day morning, how much scales of the skin he has collected also. It's a huge amount actually, it's a bunch. And this person, actually, he doesn't want to go to home also, because he doesn't, the children, wife and children will be afraid. Luckily, his face and this hand was not much affected. The internally, because he's wearing many of the psoriatic patients are wearing a full sleeve shirt and full this thing, so that if the face is and the hand is not affected, no one will know about it. So he was managing like that. So actually started the treatment. Next day itself, he is having a relief actually. That exfoliation is reduced. And that is actually what we are doing is finding immediately the result has to come for the test and all, which food is correct, which food is not comfortable for him or not reacting and all. It will take for a few days to get the whole the report. Actually, we do a very detailed analysis of the whole body, and also about the food and details. So, but we cannot wait for that for the patient who is suffering. So we start the treatment, and special minimal number of ingredient food will be advised and is actually given, and with all the nutrition for the skin to repair. Actually, for the body need to repair, all this damaged cell has to go and it has to get repaired. And within 1 or 2 days itself, he is comfortable, and he has psoriatic arthritis also. Joints were very edematous. Many of the, especially the knee joint was very edematous, and the whole joint also was affected. But within few days, he is able to be in a comfortable position, and within 30 days, because the turnover time is 30 days. Now it will take a minimum of 30 days for a reasonable improvement, because but by the 30 days itself, many of these lesions was gone. Actually, this redness and all was come down to almost 60-90% reduction was there. Now, some part it was 90%, some part it was slightly less, and it was by the actually after 1 month he was gone back to his working place, that is overseas actually, and after 60 days he sent the we always ask for sending the skin problems photos and videos of the especially the photo of the affected part. So it was almost clear after this applying special nutritional oil is given for supporting protecting the skin, and after applying the having a bath and applying the skin is perfectly all right. And in the morning we always ask for the night after bath, and then the morning, because after 8 hours or 9 hours no skin application with this only nutritional, mainly nutritional based actually. It's not there, then slight powdery scales are there, that's all.
See, if you would like to give a message to every patient, psoriatic patient who has just discovered he has got psoriasis, or patients who have been treating their psoriasis for long, but they are not satisfied with the results, what is the message that you will give them?
Yes, basically, I have seen, as I said, all the sort of different patients, and many will be, usually my patients will be diagnosed early and they were on medication. And like this methotrexate and heavy MMF, and even they might have, many of them have tried already this latest monoclonal antibodies. Like, I don't want to make the naming of this medication is very difficult, because everything will be NIB, or so it will be ending like that. Basically this immunomodulators and all sort of medicines they may be taking. They may be taking from 2 or 3 group, and also definitely steroids and local applicants. They may be in a milder form. The severe form can be reduced to a mild form. They usually, most of the patients is not getting a full relief, or they will be having arthritis and the nails will be affected, or they will be very tired and tiredness will be there. So that different way. So my message is actually, this medication is not the answer for the psoriasis. It is a lifestyle disease because of the immune overactivity. So you had to find out the reason for this overactive immune system. Our immune system is actually supposed to be protective, but it is destroying your body, your cells, skin cells, and joints, or any other part of the body. So we had to, basically understand it's a lifestyle disease, and the environmental factors, correcting the environmental factors, optimal nutrition, optimal exercise, or optimal activity, mental and physical, not only the physical, mental and physical activity, and avoiding the toxins. Toxins can be the cosmetics you are applying, and also the food additives you are using, even the food itself. Some people, we know that gluten sensitivity. Just like that, there is other food also. Different people can be different ways sensitive to different food. We had to find out that. Now there is methods to find out that. That is the most important thing. And you should learn how to live with, and how to take food to not flare up, or to keep your skin protected. So in that way you can manage. There's no problem, and you don't have to go for this immunosuppressants, steroids, or anything for a lifelong treatment is not needed. Only to learn how to manage, and what is your problem, which food is creating, or what lifestyle factors it is affecting, and find out that, and make according to the changes it is possible for you.
Thank you, Dr. Jolly. That was deeply insightful This time we saw what is the nature, the root cause, and the whole body connection of psoriasis. In the next episode, we will look at what are the latest current treatment options available for psoriasis. Welcome to the next episode of Lifestyle Disease Doctor, where we will be going deeper into psoriasis and the options of treatment. Thank you.